Hi, my name is Carl Freeman, student nurse at Miles Community College. Today I will be giving an intradermal injection. We're going to start out with verifying the physician orders and bouncing them off of the MAR. This is the physician orders that have been verified by another student nurse, Brandon. And we have transcribed that onto the MAR. So the first step in giving a Mantoux injection is to go through the 6 rights of medication administration. Right patient, right time, right dose, right drug, right route, right documentation. Next, we're going to uncap the vial, and we're going to wipe it with an alcohol swab. Next, we're going to grab the syringe, and we're going to uncap it without touching the syringe or the needle. This is calibrated at 1/16, and the order asks for 0.1 milliliters, so we're going to add 0.1 milliliters of air into the syringe. We are then going to insert the needle into the vial without allowing the needle to touch the liquid, and we're going to inject the air into there. This allows for the medication to come out easier. We are then going to turn it around into a 90-degree angle, and we're going to allow 0.1 milliliters into the syringe. We're then going to recap it. Next, what we're going to go through is we recap it because we're not in the patient's room yet and we're going to be walking with it. So we're going to want to tighten that, make sure that's tight. Patient's name is Skip Rocker. He is prescribed to receive 0.1 milliliters of insulin. So first we're gonna wash our hands. We're gonna add gloves. And while we're doing this, we're going to talk to Mr. Rocker and ask him, verify his allergies. It says that he's allergic to Celebrex. So we're going to verify that. We're going to verify his name and date of birth, because we need 2 patient identifiers. And then we're going to prepare to give the injection. We're going to take our alcohol swab and we're going to clean the skin of the forearm, starting with small circles and widening them out. Next, we are going to make sure that we have the bevel up. We are going to pull the skin just slightly, and we're going to inject the needle at 5 to 15 degrees. Normally there would be a bleb there. We're then going to take out the needle. We're not going to apply pressure or added bandage, but we are going to blot the skin to get anything that might have come out of the injection site. Next, we're going to take our pen and we're going to circle the bleb. And the reason for doing that is because in 48 hours, Mr. Rocker will have to get this viewed by a healthcare professional. And Yeah. So because the needle, or because I don't have anybody in my path, I'm not going to recap the needle. I'm just going to bring it to the sharps container. We're gonna sign the MAR, initial it, sign, time and date. We will ask Mr. Rocker if he has any questions. We will verify that he knows when to come back and get it checked, and we will send him on his way. Thank you.